Sally, I have a chipped tooth, and I was wondering if a veneer would be appropriate way to fix that.
Yes, veneers work great in many instances. Sometimes if it's a small chip, we can do a little bonding filling. If it's a larger chip or if the tooth is a different shape, they would recommend a veneer, which is a much more permanent situation.
Okay, what exactly are veneers?
Well, veneers are a very thin porcelain layer that we put over top of your tooth. It is a permanent restoration, and it is custom made to your tooth and your mouth specifically. We take impressions of the teeth, send it out to a lab, and they send back a very thin porcelain layer of tooth shape that we cement onto your tooth that is permanent. We match the shape and the color to your other existing teeth, so it looks like a very natural tooth. And it's much stronger, more permanent than a filling would be.
And do they have to grind some of the tooth down?
There are two different types of veneers. One is full prep, where they do reduce the size of the tooth a fair amount, depending on how much structure is needed to support that tooth. If it's just for cosmetic reasons and not so much for structural reasons, it's called a minimal prep veneer, and they just smooth it very, very lightly. So that is a much easier preparation. But both of them are permanent.
How long would the veneer last?
Well, that varies per person, Missy, because it depends what kind of care you take of your mouth. Some people use their teeth as tools, and that is a very bad idea, particularly if you have beautiful dental work in there. Ripping open bags, opening things with your teeth. Teeth are not tools. Please do not open things with your teeth. So that would damage the veneers much more readily. Keeping your gums healthy, what typically goes bad is people are not maintaining their tissue health. The gums recede a little bit, and we see the edge of the veneer, or some stain gets around there, and then when you smile, if you have a big gummy smile like I do, it's showing the edge of the veneer now, so that's not cosmetically what you'd like. So the healthier you keep your gums, the less you use them as tools, the longer your veneers will last.
Oh, great.